Abdominal cavity and peritoneum. Abdominal cavity is the largest cavity in the body. It encloses the organs of digestion, excretion, reproduction. Quadrants of abdomen. Abdomen is divided into 9 quadrants by 2 vertical imaginary planes and 2 horizontal imaginary planes. Vertical planes are right and left lateral plane. These are mid-clavicular lines which pass through the tip of 9th costal cartilage and mid-inguinal point. Horizontal planes include transpyloric and transtubercular planes. Transpyloric plane of Addison passes midway between the suprasternal notch and pubic symphysis. It is about a hand's breadth below the xiphisternal joint. Anteriorly, it passes through the tip of 9th costal cartilage. Posteriorly, it passes through the lower border of L1 vertebra. Pylorus of stomach, duodenum, neck of pancreas, and hilum of kidneys. Fundus of gallbladder lies at this level. Transtubercular plane passes through the tubercles of iliac crest. Posteriorly, it passes through the upper border of L5 vertebra. Regions in median part: epigastric, umbilical, and hypogastric. In the right and left side, hypochondrium, lumbar, and iliac regions. Peritoneum. Peritoneum is a serous membrane that lines the abdominal cavity. It reflects over the viscera and invests it either completely or partially. The part which lines the abdominal wall is parietal layer, and part which invests the organs is visceral layer. Parietal peritoneum. It lines the abdominal wall, pelvic wall, and inferior surface of diaphragm. It is separated from these structures by extraperitoneal connective tissue. Parietal peritoneum is developed from somatopleuric layer of lateral plate mesoderm. Hence, the blood supply and nerve supply of parietal peritoneum is similar to that of body wall. Since this layer is supplied by somatic nerves, it is sensitive to pain. Visceral peritoneum. It lines the outer surface of viscera. It is firmly adherent to the viscera and forms a part of it. Visceral peritoneum is developed from splanchnopleuric layer of lateral plate mesoderm. Hence, the blood supply and nerve supply of visceral peritoneum is similar to that of corresponding viscera. Since this layer is supplied by autonomic nerves, it evokes pain when viscera is stretched or distended. Folds of peritoneum. Many abdominal organs are suspended by folds of peritoneum. These organs are termed intraperitoneal. Examples are stomach, jejunum, ileum, transverse colon, cecum, appendix, Some organs are partially covered by peritoneum. Examples are ascending and descending colon, rectum. Some are present in relation to the posterior abdominal wall behind the peritoneum. They are called as retroperitoneal organs. Duodenum, pancreas, kidneys, ureters, and suprarenal glands are retroperitoneal. Peritoneal cavity. The abdominal viscera invaginate the peritoneal cavity and reduce it into a small potential space. A thin film of serous fluid is present in this potential space. This fluid is secreted by mesothelial cells. The peritoneal cavity is broadly subdivided into two spaces, greater sac and lesser sac. Lesser sac, also known as omental bursa, is situated behind the stomach. It communicates with the larger greater sac through the epiploic foramen. Peritoneal cavity in males is a closed sac. In females, the peritoneal cavity communicates with the exterior through the uterine tubes. Peritoneal folds. Greater omentum. Greater omentum is the largest fold of peritoneum. It hangs down from the greater curvature of stomach and covers the coils of intestine to varying extent. Greater omentum is made up of 4 layers which fuses to form a thin fenestrated membrane containing variable quantities of fat. Blood vessels traverse through it. Attachments. Anterior 2 layers descend from the greater curvature of stomach. They cover coils of intestine to varying extent and fold upon themselves to form posterior 2 layer. Thus, the first layer forms 4th and second layer forms 3rd layer. Posterior 2 layers ascend to the anterior surface of head of pancreas and anterior border of body of pancreas. In the upper part, 4th layer is partially fused with the transverse mesocolon and anterior surface of transverse colon. The space between the second and third layers, that is, part of lesser sac, is obliterated in most extent, except for about 2.5 centimeters below the greater curvature of stomach. Contents. Right and left gastroepiploic vessels run within first and second layers of greater omentum, close to the greater curvature of stomach. Adipose tissue. Functions. It acts as a storehouse of fat. When infection occurs at a particular site, the greater omentum moves to the site of infection and seals off the infected part from surrounding areas. This helps in prevention of spread of infection. Hence, the greater omentum is often termed as policeman of the abdomen. The macrophages are studied in the greater omentum. They form milky spots. They protect the peritoneal cavity against infection. Lesser omentum. Fold of peritoneum which extends from liver to stomach and first 2 centimeters of duodenum is known as lesser omentum. It includes 2 parts, hepatogastric ligament between liver and stomach. Hepatoduodenal ligament between liver and duodenum. Attachments. Superiorly, it is attached to the liver in the shape of inverted L. The vertical limb of L is attached to the floor of fissure for ligamentum venosum. Horizontal limb of L is attached to the margins of porta hepatis. Inferiorly, it is attached to the lesser curvature of stomach and to upper border of first 2 centimeters of duodenum. Lesser omentum has a free right margin. Epiploid foramen lies behind this free margin. Contents. Right free margin of lesser omentum contains proper hepatic artery, portal vein, bile duct, lymph nodes, hepatic nerve plexus. Along its inferior attachment, it contains right and left gastric vessels, lymph nodes, branches of gastric nerve. Mesentery. It is a broad fan-shaped fold of peritonium which suspends the coils of jejunum and ileum from posterior abdominal wall. It presents 2 borders, vertebral border or root, intestinal border or free border. Root of mesentery is about 15 centimeters in length. It extends from left side of L2 vertebra at duodenojejunal flexure to the right sacroiliac joint at iliocecal junction. Structures crossed by root. Third part of duodenum. Abdominal aorta. Inferior vena cava. Right gonadal vessels. Right ureter and right psoas major. Right genitofemoral nerve. Right sacroiliac joint. Intestinal border. It is the free border. It is frilled about 20 feet long. It encloses the jejunum and ileum. Contents. Jejunum and ileum. Jejunal and ileal branches of superior mesenteric artery. Lacteals and mesenteric lymph nodes. Loose areolar tissue. Nerve plexus. Fat. In jejunal part of mesentery, the fat is confined along the root. In ileal part, fat spreads throughout the breadth of mesentery. Hence, translucent windows are well appreciated in jejunal mesentery and they are absent in ileal mesentery.